action.
Hi, my name's Riley and I'm going to be your nurse today. Can you please tell me your name and date of birth?
Caroline Goss, February 9th, 1999.
This is the correct patient. So before we begin, I will be performing a focused assessment on you. It shouldn't take any more than 20 minutes, and if you have any questions or you feel uncomfortable along the way, please feel free to ask me. The patient understands the purpose of this exam. Before we begin, I'm going to ask you to empty your bladder and put on this robe. It ties in the back. Are you comfortable with the privacy and warmth of the room?
Yes.
The patient is comfortable in regards to environment. So before we begin, I have a few questions for you. Have you noticed any difficulty or changes in moving about recently?
No.
Do you have any decreased strength?
No.
Have you noticed any more difficulty doing your activities of daily living?
No.
And are you currently in any pain in your muscles, bones, or joints?
No.
Okay, sounds good. So I'm gonna have you stand up. The patient is standing erect. The limbs are symmetrical and straight. The body overall looks generally symmetrical. The knees are aligned with the hips and ankles, and she's able to maintain her own balance. So now I'm gonna look at your back. There are no deviations of the spine noted. The cervical, thoracic, and lumbar curves are all present. And the shoulders and hips are level and symmetrical. So now I'm going to ask you to do a few motions. Let me know if you have any pain while you're doing them. So first, bend forward from the hips, bend backwards from the hips, left and right, and then rotate your trunk left and right. Perfect. The patient is able to engage in a full range of motion with no pain noted. So you can have a seat now. The neck and spine are straight. Now I'm going to press along your back. Let me know if you have any pain. Did you have any pain?
No.
All right, the patient experienced no pain. The shoulders are level and symmetrical, and muscle tone is present. So now I'm going to look at your arms more closely. There's no edema or redness noted. There are no twitches or spasms noted. And everything appears generally symmetric. So now I'm going to palpate your shoulders, arms, and fingers. Let me know if you have any pain. So there is no edema or swelling in any of the areas. There's no enlargement of the joints either. So I'm going to ask you to, I'm going to feel the temperature of your arms with the backs of my hands. So the temperature of the joints and surrounding muscles are uniform, and there are no areas of increased warmth. So I'm going to offer some resistance, and don't let me push or pull your hands. So don't let me pull them back, and don't let me push them. So bicep and tricep strength are both equal with 5 out of 5 resistance, and there was no pain noted. So now I'm going to look at your legs. So the knees are in line with the ankles and the feet. The toes are extended and flat on each foot. The overall appearance is generally symmetric, and there's no atrophy noted. So I'm going to gently press. Let me know if you have any pain. There's no noted pain or edema in any of the knee, ankle, or toe joints. So now I'm going to feel the temperature of your legs with the backs of my hands. The temperature of the joints and surrounding areas are uniform with no areas of increased warmth. So now I'm going to offer resistance, so don't let me pull your legs out, and don't let me push them in. Great. So she offered resistance, 5 out of 5, with no pain noted. And that's all.
Thank you.